one of the things that I found is the mental health side is significantly uh, neglected
Mm-hmm.
because, for one, there's that element of privacy. So, when you think about the mental health, a lot of times we think about the cognitive side, but there are also issues with addiction. Like
Mm-hmm.
I've had a couple of patients who've had addictions to porn,
Mm-hmm.
and these types of things are ruining marriages.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to Neuro Wellness Conversations, where clinical insight meets lived experience. We're two physical therapists having real conversations about neurologic wellness, nervous system health, and what it takes to support both in everyday life. And today we're talking about something that we see all the time with Parkinson's, but it doesn't always get explained clearly. How much movement, sleep, and stress are actually shaping what people experience day to day.
Absolutely, yes, because this isn't just theory. This is what we see all the time in the clinic as neurophysical therapists. So first talk about the movement side. We hear that all the time that exercise is medicine for Parkinson's. And this is true, but what's often missed is how the exercise is prescribed.
Mm-hmm. Yes, exercise is super important, and we have to be intentional about what we do with our Parkinson's clients
Exactly.
and
Yep.
understanding what their needs are. That's the
Right.
beauty of it. That's what I like about it is I get to understand what your needs are, what things you like to do,
Mm-hmm.
and then incorporate it and make it fun but challenging in the clinic.
Correct. Exactly. So we use our skill set, our knowledge to kind of delineate exactly what it is that that person who's in front of us at that particular time needs, whether they need an exercise program with a consideration of their movement capabilities with regard to timing,
Mm-hmm.
whether it deals with dosing, whether we're working on someone that's really having a significant difficulty with things like dual tasking or
Mm-hmm.
fascination. So, and then we have to take into consideration, amplitude based training. So, yeah, we with Parkinson's, it's movement that we have to work on and we have to consider, but it's also more than just movement because movement doesn't exist in a vacuum.
That's true.
Movement is so correlated to so many other factors, like we talked about last time with regard to a lot of the non-motor symptoms of Parkinson's that oftentimes does not get as equally addressed.
Mm-hmm. So I
So,
think the other thing that we also have to think about in regards to this is when you take medication
yep,
and the dosing of that medication, how many times a day you're taking it, and when is a good time to actually perform your exercise during taking the medication.
exactly. That is huge. That's a major conversation that I have a lot of times with my Parkinson's patients because they don't realize the importance of it, and they are a lot of them are not knowledgeable of the on and off phases of Parkinson's, which
Correct.
is so important. And so when they are educated about an on and off phase, which for those that don't understand that part with regard to Parkinson's, the on phase is when they are maximizing most from the usage of the dopamine that they're taking,
Mhm.
and that dopamine is very readily available in the system. And then the off phase is when that dopamine is not as maximized or readily available, or they're lower on that dopamine in the system, so their movement is reduced, their tremors may increase, their fascination may be amplified. And
Mhm.
so the timing of the medication as well as the dosage, because in some regards we have to take into consideration when they come to us, when they present in the clinic for that therapy session, they may be overdosed in some
Mhm.
regards. I remember when I first opened my clinic quite a few years ago, I had a patient who was demonstrating significant um, dyskinesia.
Mhm.
And so when she would come for her sessions, it was hard for her to do her exercises. So one of the things I had her talk to her doctor about when she went back to see her, um, during the time that she was still coming to therapy, I told her, I said, you ask your doctor about your medication dosage and let her know what's happening to you when you're in your therapy sessions. Because it also presented to the point where she was very unstable when
Mhm.
she was up trying to do any of the standing exercises, trying to work on her balance. And fortunately, she had one of those neurologists that was very astute, very responsive to, what her patient's needs were. And she decreased her dosage. And amazingly so, when she came back to that next session, the difference was so significant on her movement and her stability. This lady was beaming because she was now able to do her exercises without
Nice.
having all of that, dyskinetic movement. And she
Mhm.
felt so good because now she can, uh, train with greater amplitude and perform her activities and not feel like she was just, not participating the way that she really fully wanted to
Mhm.
and knew that she could. So
Yeah.
yeah, that's huge when we talk about the medications in that regard.
And also, having a relationship with the neurologist is super key because as therapists or clinicians, I should say, we see these clients way more than they do on a
Yeah,
regular basis.
absolutely. Yeah,
They may go to their neurologist. You may go to your neurologist twice a year, and
right.
one is a virtual call, so they don't even see you in person, but one time a year.
Yeah, yeah.
So we note a lot that we recognize those changes way quicker than your neurologist would. So super
Correct.
important that we maintain a relationship, build a relationship with them,
Right.
that we're reporting regularly what's going on.
Absolutely. And that's part of why I always made a concerted effort to know the neurologists in
Mhm.
my area. Um, if I hear a new name, I'm trying to figure out where they are and how I can find them.
Yeah.
I'm on a hunt because ultimately I tell the doctor and I tell my patients, really, it's for your benefit. It's for the benefit of the client. And then
Yes.
in the long run, I always tell the doctor, I was like, really, it makes you look good because
Absolutely.
when that patient comes back to you, better balance, better endurance, moving and walking with greater stability,
Mhm.
you look like a champion because you made this referral.
So true.
And so, there you can pat yourself on the back. So you look real good. So they love to hear that.
That is so true. But I
Yeah.
remember having a case with a Parkinson's patient that had been going to this neurologist maybe for the last 5 years. And he just kept increasing the dosage, but never referred him out to physical therapy.
Oh
And
wow.
then eventually, this client eventually went to like an orthopedic clinic, and they ended
Mhm.
up sending him to me. But he had been on the Parkinson's med so long that it wasn't working.
Right.
So I referred him to a whole different movement disorder specialist because I'm like, you need to see this person so
Right.
that we can figure out your medication dosage and what you need right now so that you can function.
Yeah.
And he
Yeah.
was so grateful for that.
Absolutely.
You know,
Absolutely. That's real.
it's really real. But
Yeah.
it just kind of made me sad that I'm like, you're driving to Boston, which Boston is like the capital of medical care, right?
Right.
You have the
Right.
best up there, but
Yeah.
you have this neurologist that only can be seen on a Friday. So you're
Wow.
driving to Boston on a busy Friday
Friday.
with crazy traffic, and he's just checking your dosage and just providing you more because you're having worse symptoms.
Yeah.
We
Yeah.
gotta we gotta think about that. Does that make sense?
Exactly.
That
Exactly.
doesn't make sense.
And that's it. That's clearly a part of what we're saying today about having the team
Mhm.
when it comes to patients with Parkinson's and actually patients with all neurological disorders.
Yes.
Because in order for it to really work, there needs to be a collaborative effort on more than just the doctor. Um, because, like you said, they don't see that patient as often as we do. So that
Right.
PT, that OT, that speech therapist, that trainer, that wellness advocate, that those are the members of the team that can
Mhm.
help make that caregiver, that, those are the members of the team that can help this patient be most successful. And
Mhm.
so sometimes, you might, uh, that original team member may not be the best team member.
I agree. Oh, that's real. Mhm.
And you've got to have somebody that can say, hey, how about this, or
Mhm.
think about this other person. And
Mhm.
the beauty is also knowing that it's good to have options and to know when to suggest those options to the patients for their benefit.
Absolutely. I mean, we have to advocate. 'Cause even with this same client that I'm still thinking about, we got him to the new movement disorder specialist, but he started having nightmares because she had put him on Rytary.
Okay.
And I was like, okay, this may not be working. This
Right.
he's having these nightmares. He's
Yeah.
hallucinating. So I
Right.
called her on the phone and said, I don't think whatever dosage of this Rytary you gave him, this is not it. Like we got
It's
to
not
figure
it.
out something else because he's not doing too well at home right now. And this
Right.
guy, he drove from New Hampshire to come see me in Massachusetts.
Oh, wow. Wow.
So I wanted to make sure that he was good to go, safe on the road, you
Yeah.
know,
Yeah.
knowing how to take care of himself. He lived alone, all of that.
Right.
So I was on the phone with her, like, listen, this medication isn't working for him. So what's another option that we can do to help him be able to be functional?
Yeah.
Advocating is golden.
Yeah, absolutely. And medication can be so significantly impactful with regard to patient sleep as well. Like you're saying with the
Absolutely.
nightmares and the night terrors. Because if they're
Mhm.
not sleeping, they're going to come to therapy with so much fatigue
Brain
and
fog.
brain fog, and
Mhm.
that's going to affect how they are with regard to their treatment session. And then if they're not getting the full benefit of the treatment session, then it's really not fully serving them like it actually should.
I
So that
agree.
kind of leads into our next point where we're talking about sleep,
Mhm.
because like we've said in earlier segments, this is such an important part of all neuro patients,
All neuro.
all human be-
ALL and capitals.
all human beings, really, honestly.
Really.
Because if you're not sleeping, you're not functioning.
That is correct. That is correct. And I think especially for the neural population in Parkinson's, that sleep is not talked about. It's kind
Right.
of glazed over,
Yeah.
and it's a non-motor, symptom
Yeah.
that isn't talked about in Parkinson's. But
Right. Yeah.
if your brain isn't functioning already because you don't have enough dopamine, and then you're not getting sleep on top of that,
On top
how do
of that.
you really expect to be able to function throughout the day? There's just
Right.
no rhyme or reason.
Yeah. Because if you're not sleeping, you're not able to retain. You're not able
That is
to
correct.
adapt. You're not able to, switch over like you should appropriately when you're supposed to. You notice your motor symptoms are actually not.
They're
Um,
worse.
yeah, they're worsening.
Hmm.
Um, you're not recovering.
That's
So
right. Your brain is not recovering. If you don't get REM sleep, you're not getting rid of neurotoxins from your brain.
correct.
You can function the next day.
Exactly.
And it kills me when people say, "Oh yeah, I sleep. I get good sleep." Do you really get good REM sleep, or are you just getting 8 hours of light sleep,
Right.
still waking
Ex-
up tired?
Exactly. Exactly.
It
If the
drives me
sleep,
crazy. Oh yeah, I get 8 hours. Do you really get 8 hours?
right,
That's the
right.
question.
I think we're so used to saying that number that
Hmm.
it just we regurgitate it
We
sometimes,
do.
even though it's actually not true.
I
Because
agree.
if we were to really be honest with regard to how much sleep we're actually getting, we're
Hmm.
not even many of us are not
No,
even close to that 8 hours
no.
that we
I get about 6.5 myself. Six,
yeah.
6.5 hours, the most.
Yeah. I'm a good 6 to 7 because
Hmm.
that was a questionnaire actually when I went to see my doctor earlier in the year, and she was like asking how many hours of sleep would I would say that I'm getting, and I said I'm probably getting about 6 to 7 if I were to be honest about what I consistently do. Now there's the occasional 8, that I
Yes,
but for me my true um test when it comes to my sleep is how do I feel when I get up in the morning. Um,
hmm
and a lot
that's
of our
separate.
Parkinson's, yeah, our Parkinson's patients are not recovering because they
Nope,
wake up and they're still fatigued.
that is correct. That is correct. We got to change that. We
Yeah,
really do. So even if they're doing the right exercises, if you're not sleeping, it kind of just balances. It doesn't balance itself out. It cancels itself out. That's what I should say.
exactly.
It
Yeah,
really doesn't make a difference.
doesn't make a difference.
And
Sleep,
the progression is going to be quicker because your brain is not healing.
correct. Yeah, and sleep is where neuroplasticity is occurring.
That is correct. That's a
Yeah.
big one. That's why I try to
Huge.
tell my stroke patients, Parkinson's patients, I need y'all to get sleep. And they look at me with my, my brain health assessment stuff, and they like, well, that's not really a part of therapy. But I'm like, we need to know what's happening on the inside
Absolutely.
of your nervous system.
Right.
So if we can figure out how you're sleeping, really, are you really getting REM sleep, or are you really getting what you need?
Right.
And if that's not happening, then we need to incorporate that into your plan.
Absolutely. And that's the relevance of what you do in regard to your brain health assessments because you can help people in so many ways, not just,
Yes.
our Parkinson's and our stroke patients, our MS patients, our brain injured patients, our epileptic patients, but the general population, the executive, like your market um,
Hmm.
works with, those are people that probably don't even think that this is applicable to them, but it is absolutely applicable to every. God
Every
created rest for a
yes,
reason.
yes.
Now, if He rested on the seventh day,
That's true. You're right about
who
that.
are we to think that we can cope
That's
without
true.
sleep and resting? And I think that's where we get it wrong. We screw that part up badly.
We do.
And and yeah, I mean, when we're young, we're we've got so much energy and vigor and we can
Oh
kind of
yeah,
get away with it. But as we get older and these bodies start to change, we have to learn the value of, rest and recovery.
that
And
is
our
correct.
Parkinson's patients are no different because we need their brains to be able to process and to store things and um, facilitate their movements throughout the day. Sometimes they struggle cognitively because
Hmm.
they have not rested and slept.
That is correct.
And so, if you are someone that has Parkinson's, even if you don't have Parkinson's, but we're particularly talking to our Parkinson's people in this segment, you need to be sleeping. And if you're not sleeping and you want to figure out why, you need to get a brain health assessment. And Dr. Banks is the professional for you to do that.
Absolutely. Get a deep dive of what is exactly what is happening with your nervous system.
Right.
Really cool phenomenon where you can literally see how you sleep, what your stress levels look like, your cognition,
Yeah.
your inflammation, your brain age, things that your medical doctor would never tell you in a
Yes.
visit.
Yeah. Most of them. There are a few, but then most of them don't. And speaking of stress, let's bring stress into the picture.
Oh, the stress of the nervous system. This is the piece that patients often feel the most, but don't always understand it.
Yes, that's
But
true.
stress can literally worsen your Parkinson's symptoms,
Absolutely.
especially the tremor, the freezing of gait, and also cognitive function.
Absolutely.
And I've seen this in practice. I
Every day that I'm
every
working with a
single day.
Parkinson's patient, I see it. I've heard patients complain about, having good days and bad days. And a lot of times it's sleep and stress. And
That's
they
it.
don't even realize it
Hmm.
until someone like you or I kind of pointed out to them because it's a segment of their medical care that often gets neglected, unfortunately.
Correct.
You know,
Correct.
and like we said earlier, the motor side, the movement side is often so um, pushed and
Hmm.
talked about that these other factors, these non-motor factors, often get pushed into the back
The back.
behind the movement aspect. And so they don't realize that that stressful day that they had or
Hmm.
that stressful night that they had
Right.
is a factor in influencing why their tremors have exacerbated the next day or why they're now
Hmm.
festinating so much the next day, whereas the previous day they were walking just fine.
Yeah.
Why they're needing the walker today versus needing the cane yesterday.
Hmm.
So stress is huge. Stress
Big,
is
big
huge.
deal. I mean, we have an autonomic nervous system, and one part is the rest and digest, which is what we need for normal function.
Yep.
Then you have the fight or flight
Yes.
component of it. So when your fight or flight's through the roof,
Right.
nervous system doesn't regulate stress response as well at all.
Exactly. Yep.
And majority of the Parkinson's patients that did do a brain health assessment, they were all in the red.
Yeah.
That backup system was keeping them afloat.
Right.
So we
Wow.
got to change that.
Yeah. Yeah. That's
You know,
amazing.
and it makes a difference when they actually see it on paper and they're like, oh, that's what my nervous system looks like.
Looks like. And it's fascinating to see. I remember when you did my assessment, it was amazing to see because now I had a picture in
Mm-hmm.
front of me that was reflective of what was actually physically going on.
Right.
And I think that's so huge with the brain health assessment because it gives them a tool that they
Mm.
can visually see. And then as the changes occur, then that's also something that they can see and process and
Right.
work towards. work towards improving. That nervous system is a major factor. And
Yes,
if it's dysregulated, then there's going to be a whole lot of chaos on the internal side.
absolutely. Absolutely. So we got to talk about how do we address this?
So for them, they've got to work on different strategies. I know one of the neurologists who was in this area was very big on mindfulness,
Mm-hmm.
um,
A big one.
yoga,
Mm-hmm.
some of the things they practice, learning how to just breathe. You know,
Yes. Breath work's a big one.
breath work is huge. Um,
Yes.
and so these are some of the things that they can actually do to help facilitate bringing down those stress levels.
Absolutely. And also brain dumping.
Yeah,
Whatever's on your mind, write it down. It
write it
doesn't have to
down.
be in any type of order or any, real fashion. Just get it on paper
Exactly.
and prioritize the next day, maybe two or three things that you want to accomplish.
Right, right.
So that you have a plan when you do get up the next day and you're
Yeah,
not stressed out thinking about X, Y, and Z.
yeah, yeah,
you know,
yeah,
those are some things that I do personally.
yeah.
I like
Journaling, yeah,
journaling
or
big.
brain dumping, like you just said, is huge. You know,
Hmm.
and I don't even think I've ever asked any of my Parkinson's patients if they do it. Actually, I know I do it, but that's probably something for me to start asking them if that's something that they do.
Yeah.
Um, and maybe aiding them and incorporating that into their day. I know I always try to get them to find something salient,
Hmm.
because I do know that is part of what
Neuroplasticity.
facilitates neuroplasticity, and it helps to bring some segment of joy into their life. Like I
Yeah.
was talking today actually about a client that I have who really struggles with motivating himself to do exercise.
Hmm.
And I asked him one day when I was working with him, I said, "What do you do all day? Tell me a little bit about your day." He was like, "I sit and I watch TV pretty much all day." I said,
Mm.
"Really?" I said, "You don't, you're not exercising, and we talked about the importance of him exercising and moving. Is the reason why he started coming to us in the first place, because he was referred by the doctor because
Mhm.
of falls. And so
Ah,
we got into that part of it. But I told him, I said, you've got to find something that you enjoy. So we happened to discover in one of the sessions that he is a sports junkie, loves basketball. And
nice.
so one of the things we started to do was incorporate a cognitive aspect of
Mhm.
asking him basketball history
Yes.
while he was doing some ambulation on the treadmill. And he lit up.
I love that.
Different face
Yeah,
altogether that session. It was so amazing to see. Uh,
I love that.
and he started to have a smile on his face, and he just started enjoying the session, and I was pleasantly surprised to see how much he knew.
I love that. Yes.
And I'm a basketball fan myself, especially basketball from back in the day with, Magic Johnson and the Lakers. So I was able to kind of ask some questions of some of the things relative to some of the things I knew, and he knew it. We were kind of having a good session together, but it was really good, and that was what in the back of my mind, I'm just saying to myself, salience, because you can see
Mhm.
that this very, very relative to the things that he enjoys, and his movement got so much better because he put out the effort even
See,
more because he was
love it.
enjoying it. And I was like, this is it. This is what it's all about.
This is what it's about. Understanding what the client needs
Needs.
or what their
That's
likes
right.
are, incorporating
Right.
it into
Yeah.
their treatment plan.
Because he didn't
That's
see it anymore as a stressful activity. He saw it as a
no.
fun activity. So therefore, his motor control started to demonstrate improvements. His balance started to get better. His movement was better because his amplitude of movement started to increase. So these are things that we know how to
Mhm.
facilitate a patient with, and it's part of why I enjoy working with neuro patients so much, because when you see things like this happen, you're like, wow, this is what it's all about.
Yes, it gives me great joy to be able to see people kind of wake up. Sometimes they come to the clinic, they're depressed or sad, they don't want to do anything, but then you start to get to know them and what their likes are. They
Absolutely.
just open up and they don't want to leave.
There you go.
They want to stay, and it's like you met all your goals.
Do I have to go? Yeah.
Yes, yes, especially with the balance stuff. Like you start people by the wall, and they're like, "What are we doing?" And
Yeah.
then like 6 to 8 weeks later, and they're in the middle of the room doing the same stuff, and they're like,
Yep.
"I never would have imagined being able to do this."
Yeah,
But again,
exactly.
just getting them to do things that they like to do and incorporating it, and
That's it.
they can
That's what it's
do
all
more than
about.
they think.
Yep. Exactly. But then also delving into a lot of these things, like we talk about stress,
Mhm.
sleep,
Mhm.
recovery, fatigue, stiffness,
Oh
uh,
yeah.
pain. Those all of those factors are things that we as neurotherapists really dive into with our patients. And so
Yes.
because we dive into those things, we kind of can facilitate how to help them improve a lot of that.
Yes. And we
So
have
it's
to go ahead, finish your thought.
no, I was gonna say, so it's a big picture. It's a full cycle for them.
Mhm.
Yeah,
Definitely a full cycle, and we have to see you as a whole. We
yeah,
can't just do one thing and not the other. It all
exactly.
works together.
All works together. That's right.
And that's why we do a deep dive on that initial evaluation.
Yeah,
I want to
yeah,
know what are your interests? What do you like to do when you're not in therapy? What do you like to do for vacation? What are
yeah.
your favorite foods?
Right.
What are favorite memories that you have? And it really does gives us a insight of
Yeah.
who you are.
Who you are. Yeah, and some of the things that you enjoy, and it also allows us to pull some of that into your sessions.
Yeah.
So it doesn't seem like a laborious activity. It doesn't seem like that therapy session that you just don't want to come to because the doctor sent me here, that kind of thing. Something that you look forward to doing and look forward to coming. So, I got to kind
Yes,
of push you out the door. I'm like, all right, it's time for me to go home.
that's real. That's so real. But it's wonderful.
It
It's like,
is.
wow,
Yeah,
it's really nice to see people to be able to be a part of the transformation. And that's what I
absolutely.
love about what I do.
Yeah,
And somebody
yeah,
asked me, like, what is it that you like to do? Or can you describe something that, inspires you? And I'm like, just being a part of that transformation of helping
absolutely.
someone be better,
Yeah,
So
that's why
yeah.
we do it. That's why we're so passionate about it, because it's all about seeing the patient get better, have a
Hmm.
better quality of life, and
Yes,
maximize on what they can do, because that's what life is all about. You know,
absolutely. Ab-
that's what it's all about.
yes. Did we
So
touch upon a little bit? Oh, go ahead.
what do you feel is um what would we say is missing in regard to the current care model of care?
I think the biggest one would be the early and preventative care component, or lack of early and preventative care.
Yeah.
Um, I've witnessed in my career so many Parkinson's patients that just never go to therapy. They go to the neurologist, they get their dosage of medication, and we never see them until they've progressed.
Yeah, that's
Whereas
real.
we should be seeing you early on
That's real.
when
Yeah,
you're first diagnosed,
yeah,
even if you're fully functioning.
yeah.
Come see us.
Come see us.
Let's do
Yeah,
an eval. Let's do a deep dive. Let's educate you on what you need to be doing to
yeah.
maintain where you are.
Right.
And if something were to occur, then you know to come back so that
Yeah,
we can reevaluate. But that is the biggest one, especially in our younger Parkinson's
absolutely.
population.
Yeah, that's what I was just thinking of. Yeah, when you said that. And it's so funny. I think that has to do with what we spoke about earlier with having the team, because they're seeing the neurologist.
Mm-hmm.
So the neurologist, their job now is to say, okay, you're early on in your Parkinson's, you're young onset Parkinson's um, person, but I still think it's beneficial for you to go to therapy. Let me send you or
Mm-hmm.
refer you to therapy. Um, and having a doctor that understands the value of what we do and what we offer, who's seeing those young onset patients, is huge.
Mm-hmm.
Because I think if they kind of say, oh, well, you're doing well, you're moving well,
Yes.
you don't need therapy right now, that's where that disconnect can also happen, where they feel like they the value of what we can offer is not there because
Mm-hmm.
they're still functioning fairly well. Our job is not just to help you to improve. Our job is to help you maintain.
Correct.
So if you're stage one, as far as modified honing you are, our goal is to try to keep you at stage one for as long as possible, but also to help you to understand that there are different stages, because you may not even know that, even though you're young. You might be moving well, but you may not even know that there's cognitive issues that happens with Parkinson's, or stressful issues, or sleep issues. So
Yeah.
you may not even understand. Like, I've seen some young onset patients who had no clue about the non-motor side of therapy.
Oh yeah. Mm-hmm.
No clue whatsoever.
That's real.
So that disconnect between the physician educating them on things and them kind of, because most people look up Parkinson's and they're going to hear about the four main symptoms.
Symptom.
Yeah. And then they don't really see anything about the other stuff. And then when they come to you, it's not those four main symptoms that are really affecting them. When they read that list about the non-motor symptoms, then you see, okay, yeah, check. Oh, wow,
Mm-hmm.
check.
Yeah.
Oh, this, yeah, check. And that
Mm-hmm.
checklist grows
Yes, it
immensely.
does. Yes, it does.
So the value of that team is so huge when it comes to that regard. So yeah, I have to agree that that's pretty significant. Yeah, the lack of early and preventative care for, especially for our young onset.
Absolutely.
Yeah,
And the other one that I think we should touch base on is the mental health and stress regulation that are under integrated.
yeah,
There's a
yeah.
disconnect there
Right.
because mental health isn't talked about. You know what I mean? They might be
Absolutely.
going to see a mental health therapist, but they're
Yeah.
not integrating that into stress regulation, physical
Right.
therapy. We're not, there's a disconnect there. There's
Yeah.
no
Yeah.
real
Yeah.
communication.
Yes. And that's again where sometimes another member of the team comes into play, because
Mm-hmm.
that person may need to go see a psychologist.
Yeah.
Um, One of the things that I found is the mental health side is significantly uh, neglected,
Mm-hmm.
because, for one, there's that element of privacy. So when you think about the mental health, a lot of times we think about the cognitive side, but there are also issues with addiction. Like
Mm-hmm.
I've had a couple of patients who've had addictions to porn.
Mm-hmm.
And these types of things are ruining marriages,
Yeah.
putting significant stress on the caregivers.
Mm-hmm.
And so for me, what I do is I'll recommend and refer those patients to a neuropsychologist that's in our area. That's not my wheelhouse by far. So I'm not going to try to address it, but
Right.
I'm pulling in that other team member. So the mental health side, and also with regard to the cognitive side, because um, that's that's a huge area with Parkinson's. There's been a lot of research also coming out lately relative to Parkinson's dementia
Mm-hmm.
and the significance or correlation with regard to presentation and cause being similar to Alzheimer's. And
Mm-hmm.
so that's another side of it that
Yeah.
really needs to be discussed and addressed, because there are some people who have that symptom more so than the motor side of things.
That is correct.
Yeah.
I have to agree. You took it right out of my mouth. Yes.
This is a Parkinson's is my wheelhouse. This
Yeah.
I I can talk about Parkinson's
You sleep.
and yeah, in my sleep. Yeah, I probably do. I need to ask my husband.
That is too funny, but you are the guru. Yes.
Yeah, hey, it's a niche that the good Lord, I should say, placed upon me.
Mm-hmm.
Um, I didn't go looking for it. He kind of just laid it there, and in obedience,
Yeah.
I'm doing what I'm supposed to do, and I enjoy every minute of it.
I love that. And God is so good.
He is indeed. He is indeed.
Wow, this has been an amazing conversation.
It has. It has. It helps us to understand and realize that um, Parkinson's is not just about the movement side of it. The relevance of Parkinson's is so um, grossly encompassing in so many other ways that we have to be willing to address to
Yes.
help our Parkinson's patients have the best outcome that they can possibly have.
Mm-hmm.
So um, I enjoyed every minute of having this conversation.
Yes. And I want to thank our audience for joining us tonight. And if this resonated with you, share it with someone who could benefit, and we'll see you next time.
Absolutely. And if we truly want to change our outcomes in Parkinson's, we have to stop treating it as just a motor disorder, a
Yes.
movement disorder, and we have to start treating it as a brain health, a sleep, and a
Yes.
nervous system regulation condition.
Yes.
Thank you all for listening, and until next time. Thank you for listening to Neuro Wellness Conversations, where clinical insight meets lived experience. If today's conversation resonated with you, share this episode with someone who could benefit. Be sure to subscribe so you don't miss future conversations on neurologic wellness and nervous system health. Until next time, keep supporting the nervous system that supports you.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline.